Hi, I'm Dr. David Amador with Midtown Dental Studio, and I want to go over pro tips on things to know before you have a dental implant. Pro tip number one. Whoa. Let's not talk about implant yet. Why did the tooth fail? First thing you should be talking about with your dentist is, why did this tooth fail? Did it break right down the middle with no fillings or anything on it? Is it because your bite is out of line? Was it cavities? Well, then let's assess the other teeth before you put an implant, so that way you don't lose another tooth. Let's find out what the etiology of the tooth that just broke is before we move into an implant. Pro tip 2, when was your last dental checkup? In Midtown Dental Studio here, if there's infection, gum infection, tooth infection, or anything like that, we are not placing an implant. Why? If there's infection or bacterial infection of the gums, your implant has a higher chance of failure. So it's really important to know, what is the status of your oral health? Get a full evaluation before you go forward with just an implant. Pro tip number 3, what is the status of your overall health? When was the last time you saw your physician? Not your dentist, not your best friend, not Google, not WebMD. When was the last time you actually got a full checkup? Why? Very simple. Diabetes, for example. Diabetes, if uncontrolled, decreases your immune system. So you have a higher chance of an implant failure, gum disease. There are a multitude of different diseases or soft tissue disorders that can cause implants not to take. So we want to make sure before you have any surgery, we are in a healthy environment. So that way you don't have to have extra surgeries. Pro tip number 4, are your teeth aligned? Your teeth being aligned is the same thing as car tires. If the car tires are misaligned over time, the tire can be replaced. But what about the wear and tear it does to the rest of the car? Well, the analogy of the tire being replaced is like your teeth. If you're missing a tooth and it broke because the teeth were misaligned, the idea is put everything back into alignment so you don't have this issue occur again. So when talking to your dentist, have them evaluate, are your teeth aligned? Are there improper contacts, improper function? So that way you're planning for success. Pro tip number 5, man, if you're going to a dentist and they are looking at old school film, or they don't have a 3D imaging so they can see the bone three-dimensionally, you gotta go. If you can't see the anatomy of where the implant is going, it now becomes more of a guessing game. The beauty of modern technology and modern dentistry is we're able to see everything beforehand. We are able to plan out this surgery from the beginning to the end without even touching you. Dental implants are amazing. They are the best way to replace a missing tooth. The whole goal of all of this is that you set it up for success. So that way it's a home run all the way to the end.